Hi students, today we are going to discuss the differences between type 1 diabetes and type 2 diabetes. Sometimes the question of whether this patient is a case of type 1 diabetes and type 2 diabetes, it makes some confusion in our OP practice because the treatment of type 1 diabetes and type 2 diabetes are entirely different. So what are the differences between type 1 diabetes and type 2 diabetes? As we all know, that type 1 diabetes is diagnosed in children and type 2 diabetes is usually diagnosed in adults. And the type 1 diabetes is due to autoimmune destruction of pancreas causing decreased insulin secretion. And in type 2 diabetes, the mechanism is insulin resistance, mainly in muscle and also in liver. So, as a compensatory mechanism, there will be overproduction of insulin in early phases, and there will be relative insulin deficiency in late phases. So, as I told, it is due to autoimmune mechanism. So, autoantibodies will be positive in type 1 diabetes. They are anti-GAD antibodies, anti-insulin antibodies, and anti-iron cell antibody. And the autoimmune antibodies are negative in type 2 diabetes. As the type 2 diabetes is due to insulin resistance, there will be signs of insulin resistance like acanthosis nigricans and skin tax in type 2 diabetes. And the signs of insulin resistance will be absent in type 1 diabetes. If you have never seen the signs of insulin resistance, that is acanthosis nigricans and skin tax, here you can go through this picture and you can get some idea. As I told, the level of insulin is less in type 1 diabetes, so the C-peptide level will be very less. When the insulin is produced in our body, along with that C-peptide is also released. So the level of C-peptide corresponds to the level of endogenous insulin production. And the level of C-peptide is bit elevated in early stages of type 2 diabetes, and in late stages of type 2 diabetes, it will be bit less. The insulin is an anabolic hormone, so the patient is usually lean if there is insulin deficiency, and the patient is obese in type 2 diabetes, and this obesity contributes to the insulin resistance. And as there is insulin deficiency, absolute insulin deficiency in type 1 diabetes, there is high risk of complications like decay, and the complication risk is bit less in type 2 diabetes. And as the incidence or risk for complications like decay is very high in type 1 diabetes, the type 1 diabetes will get diagnosed early in the course of disease. But as the complications are less in type 2 diabetes, usually the patients comes to OP or to the doctor's clinic very late. And as there is absolute insulin deficiency in type 1 diabetes, the treatment of type 1 diabetes is insulin. And we can give OHA like metformin to overcome the insulin resistance first, and after giving the OHAs, if the sugar levels are not getting controlled, we have to give insulin to type 2 diabetes patient. So in type 1 diabetes, the treatment is insulin, whereas in type 2 diabetes, we can start with the OHA, later switch on to insulin. Thank you.